Every year, millions of older adults in America attend their routine medical checkups, believing they're doing the right thing to protect their health and mobility. But what if I told you that some of these very tests your doctor may recommend without a second thought, are quietly stealing your strength, weakening your legs, and accelerating muscle loss without you even realizing it? It sounds shocking, doesn't it? You trust the system, you follow advice, you want to stay active, independent, and safe. But buried deep within the routines of modern medicine are hidden risks that no one talks about. Not the brochures in your clinic, not the headlines, and sometimes not even your doctor. Imagine walking into your clinic with steady legs, only to find yourself months later relying on a cane, a walker, or worse, losing the confidence to move freely, and you're left asking, what happened? The truth is, certain routine tests and treatments, when overused or misused, can quietly damage your muscles and leg function, especially after the age of 60. In the next few minutes, I'll reveal the 5 most common medical tests silently destroying your strength, and exactly how to protect yourself before your next appointment. Don't look away. This may change how you approach your entire future. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type the 0 to let me know how I can make better content for you. 1. DEXA scan done too frequently. Most people over 60 have heard of the DEXA scan, the routine test that measures bone density to assess the risk of osteoporosis. On the surface, it seems harmless, even necessary. After all, who wouldn't want to prevent a broken hip or spine? But here's the truth no one is telling you. When done too often, this scan can silently set off a chain reaction that destroys your leg strength and muscle stability, and you may not even realize it until it's too late. In my years as a leg specialist, I've seen this pattern more than once. It starts with an older adult who feels just fine. No falls, no fractures, just a routine checkup. Their DEXA scan shows a slight decrease in bone density, very common with aging, but based on that minor dip, they're immediately prescribed a bone-strengthening medication, often from the bisphosphonate family, such as Fosamax or Actonel. These drugs are powerful, but when taken unnecessarily or for too long, they don't just strengthen bones, they also make them brittle, especially in the femur, thigh bone, which bears the weight of your entire body. I remember my patient Evelyn, a 77-year-old retired teacher from Minnesota. Strong-willed, always active, walked a mile every day. She came in after her 3rd DEXA in 4 years showed mild osteopenia. Her doctor prescribed bisphosphonates immediately, even though she had no history of fractures. 16 months later, she felt a sharp pain in her thigh while stepping off the curb. No fall, no trauma. Just a spontaneous femur fracture. X-rays showed the classic signature of a stress fracture caused by long-term medication overuse, not osteoporosis. The drug meant to protect her had instead robbed her of her independence. She needed surgery and weeks of rehab just to walk again. That's the danger, not Xinjiang. Not just the fracture, but the loss of trust in your own legs, the muscle weakening that comes from fear of movement, and the spiral of inactivity that follows. And it all started with a scan she didn't truly need at that time. So what can you do? Ask, do I truly need this scan now? Have my bones changed, or is this just routine? Could my lifestyle and diet be enough to maintain bone health for now? For many older adults, a DEXA every 3 to 5 years is more than enough, unless there are real signs of bone loss. But this is just the beginning, because the next test, far more invasive and far more misunderstood, doesn't just weaken your legs, it can make your nervous system forget how to move them entirely. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. EMG and nerve conduction tests without clear symptoms. You go in for a checkup. Maybe you've had a little tingling in your feet or some mild numbness that comes and goes. Your doctor, playing it safe, refers you for an EMG or nerve conduction study, those tests that measure electrical activity in your muscles and nerves. You're told it's just to rule things out. But what you're not told is that this test, done without real need or context, can set off a dangerous domino effect, one that quietly undermines your confidence, weakens your muscles, and steals the strength from your legs. Here's what's happening across the country, especially in older adults. Age-related changes in nerve conduction are completely normal. Just like our eyesight fades or our hearing gets dull, nerves slow down too. But when those normal changes are misread as signs of disease, like neuropathy or nerve damage, it leads to a cascade of fear-based medicine. People get labeled with diagnoses they don't fully understand, referred to specialists, prescribed unnecessary medications, or even worse, scheduled for back or spine surgery they never needed in the first place. I'll never forget George, a 73-year-old former mailman from Indiana. He came to me after months of confusion. He'd had a minor ache in his lower back, nothing serious. But after an EMG showed non-specific abnormalities, his neurologist told him it might be a compressed nerve. Within 2 months, he'd had spinal injections. When those didn't help, they scheduled him for lumbar surgery. Post-op, George's legs were never the same. His gait became unsteady. He lost confidence, stopped walking to the corner store, stopped gardening, and within 6 months had lost nearly 30% of his lower body muscle mass. What truly broke my heart was hearing him say, "I wish someone had told me my nerves were just old, not broken." That's the silent destruction, not just physical weakness, but the emotional erosion of trust in your own body, and how quickly that leads to inactivity, atrophy, and loss of independence. EMG tests can be valuable, yes, but in the wrong hands or ordered too quickly, they can write a script of disability that didn't have to exist. And sadly, the next test we'll talk about doesn't just mislead. It injects something directly into your joints that can quietly eat away at your strength from the inside. 3. Repeated steroid injections in the knee or hip. It starts with pain, a dull ache in the knee, maybe a pinch in the hip. You tell your doctor, and they offer what sounds like a miracle fix, a cortisone shot, just one quick injection to reduce inflammation, ease the pain, and help you move better. And for a while it works. But what no one warns you about is that these injections, especially when repeated, may be silently destroying your leg strength from the inside out. Corticosteroid injections are powerful anti-inflammatory agents. But when used too often, they do more than just calm pain. They begin to erode the very tissues meant to support your mobility, the cartilage, the joint lining, and eventually the muscles surrounding the joint. For older adults, especially those already losing muscle mass with age, this weakening can be devastating. One of my patients, Howard, a 79-year-old Army veteran from North Carolina, had been receiving cortisone shots in both knees every 3 months for almost 2 years. His doctors meant well. They wanted to keep him mobile, delay surgery, keep the pain down. But with each shot, Howard noticed something troubling. He could still walk, but his legs didn't feel strong anymore. Climbing stairs became harder. Standing up from his recliner took effort. One day, stepping off a curb, his leg buckled under him. There was no fall, no break. But something inside had clearly changed. We ran tests, and what we saw was sobering. Significant atrophy of his quadriceps and hip stabilizers, muscles essential for walking and balance. His knees had less pain, but the strength to use them was vanishing. Howard's story isn't rare. Steroid injections, especially when done more than 3 to 4 times a year, have been shown in studies to contribute to cartilage thinning, muscle catabolism, and in some cases, joint collapse. The relief they bring is temporary, but the damage, particularly to aging muscle tissue, can be long-lasting. If you've had more than 2 injections in a single joint in the past year, it's time to stop and ask, is this helping or harming me? Because the longer we rely on these quick fixes, the more we chip away at the very foundation of our strength. And now, we turn to a procedure many seniors assume is minor, almost routine. But after age 65, it may rob your legs of motion and your spirit of independence. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Arthroscopic surgery in adults over 65. It sounds simple. A small incision, a tiny camera, just a little cleanup in the knee or hip. That's how arthroscopic surgery is often described: quick, low risk, and minimally invasive. But for older adults, especially those over 65, this routine procedure can quietly do far more harm than good. And worse, it may silently begin to destroy your muscle mass and leg strength without anyone warning you. Arthroscopy is often recommended to remove loose cartilage, smooth out arthritis, or repair small tears. But here's what many seniors aren't told. Studies show that in older adults, these surgeries rarely improve pain or mobility long-term, and often leave the patient weaker and less active than before. Why? Because after surgery, even when considered minor, your body needs time to heal. That often means reduced movement, less weight bearing, and avoiding stairs or walking for days, even weeks. For someone in their 30s, that's recoverable. For someone in their 70s or 80s, it can trigger a rapid decline in leg strength that never fully returns. I saw this happen to my patient, Barbara, an 81-year-old former librarian from Oregon. She had mild knee discomfort and could still walk to the store every day. Her orthopedic doctor suggested a simple arthroscopy just to clean things up. It was supposed to be a same-day procedure, but what followed was 3 weeks of barely walking, using a walker, and relying on her daughter for everything. By the time she came to me, Barbara couldn't get up from a chair without assistance. Her quadriceps had weakened by nearly 40%, and her confidence in movement had vanished. What began as a mild ache became a life-altering event, not because of arthritis, but because of unnecessary surgical stress on an aging body. This isn't an isolated story. Arthroscopic procedures have been shown in recent medical reviews to offer no long-term benefit for age-related joint issues, yet still carry real risks: infection, blood clots, anesthesia complications, and most critically, loss of muscle through inactivity. So before saying yes to just a scope, ask, is there real proof this will help me? Have I tried conservative treatments long enough? What are the risks of weakening my legs further after surgery? And if you think that's concerning, wait until you hear about the final test, one that doesn't involve a scalpel or a shot, but something far more subtle. The test that may convince you you're fragile, even when you're not. 5. Postural stability tests that mislabel you as frail. Sometimes the most dangerous things in medicine aren't what we cut or inject. They're what we assume. One of the most overlooked ways your strength and independence can be quietly taken from you is through something as simple as a postural stability test. These are short, often casual assessments done in a clinic. Stand on one foot, walk a straight line, or shift your weight side to side. They sound harmless, but when misinterpreted, especially in people over 65, They can silently rewrite how doctors, and even you, see your own body. What happens next is subtle but serious. Based on one moment of wobble, a doctor may label you as high fall risk or mobility impaired, and suddenly you're being encouraged to use a cane or a walker just in case. You may even be referred to fall prevention programs that reinforce the idea that your legs are no longer trustworthy. This label, once applied, sticks, not just in your medical records, but in your own belief system. You begin to move less, you avoid stairs, you take fewer walks, and what follows is inevitable: muscle loss, balance decline, and a growing fear of movement itself. My patient, Thomas, a 76-year-old jazz musician from New Orleans, came to me after a visit to his primary care doctor. He'd stumbled slightly during a one-leg stand test. No fall, no injury. But that single moment led to a cascade. A physical therapist labeled him at risk. His doctor insisted on a cane. And within months, Thomas told me, "I don't feel like myself anymore." When I evaluated him, his gluteal and calf strength had dropped by over 25%, simply because he had started using assistive devices he didn't need. His confidence and muscle had both withered, not because of disease, but because of a misread test and the fear it planted. We must be careful with how we measure balance and strength in older adults. Not every shake or stumble is a sign of frailty. Sometimes it's just the body waking up, adapting, or needing training, not restriction. And that brings us to the real question. If so many routine tests are quietly stealing our strength, what should older adults do instead to stay strong, sharp, and safe? You might be surprised, because the answer isn't just medical, it's deeply human. 6. So what should older adults do instead? After hearing how routine tests, meant to help, can quietly sabotage your leg strength, independence, and trust in your body, you may be wondering, if I shouldn't blindly follow every medical recommendation, what should I do instead? The answer, surprisingly, isn't just about avoiding harm. It's about actively protecting and reclaiming your muscle strength, your confidence, and your voice in every medical decision. The truth is, the strongest defense we have as we age isn't another test, scan, or pill. It's a well-informed, personalized, and proactive plan to keep our bodies in motion. And that starts with a conversation, not just with your doctor, but with yourself. Instead of saying yes to every scan or referral out of fear, ask, what will this test change? Will it make me stronger, or will it label me weaker? One of my most inspiring patients, Martha, a 74-year-old widow from Colorado, came to me after being told she needed both an MRI with contrast and a steroid injection for hip pain. She felt pressured and overwhelmed. Instead, we chose a different path. Martha committed to 12 weeks of supervised physical therapy, focused on glute strength, balance, and walking mechanics. We reviewed her medications, her hydration, and her vitamin D levels. Slowly, her pain decreased, and more importantly, her muscle returned. Today, she walks 3 miles a day without assistance. She avoided unnecessary imaging, injections, and the creeping loss of strength that too many seniors experience without knowing why. Here's what older adults should consider. Start with function, not fear. Ask if your movement, strength, or pain truly interfere with your life, or if you're being treated based on numbers and assumptions. Prioritize strength training. Even gentle resistance exercises 2 to 3 times a week can reverse years of muscle loss. Speak up. You are not a passive patient. You're the lead author of your own health story. The medical system is not built to think this way, but you can. And that brings us to one final powerful truth. These tests may be common, but they are not destiny. So now it's time to put all the pieces together. Let's look back, reflect, and ask the real question: have we been taught to fear the wrong things? Final reflection. Have we been taught to fear the wrong things? As we grow older, we're often told that more testing means better care, that the key to aging well is catching problems early, treating them fast, and trusting every step of the medical process. But after decades of working with older adults, I've seen a quieter truth emerge. Sometimes it's not the disease that steals your strength, it's the system itself. Each of the tests we explored, from DEXA scans to cortisone injections, from EMGs to routine surgeries, was created with good intentions. But when applied without thought, without context, and without your full understanding, they can do more than just inconvenience you. They can plant fear, restrict movement, weaken muscles, and slowly convince you that you're frail, even when you're not. That's the silent danger, not dramatic, not immediate, but deeply real. You weren't born fragile. You've climbed ladders, raised families, built communities. Your body, even now, has far more capacity than you've been led to believe. What you need most isn't another test. It's clarity, caution, and the courage to ask, is this truly right for me? There is wisdom in doing less. There is strength in waiting, watching, and trusting your instincts. And there is power in knowing that not every decline is inevitable. Some are preventable. If anything in this series has spoken to you, let it be this. You deserve care that sees you, not just your chart, your age, or your insurance code. Your muscles matter. Your strength matters. And you are not a passive passenger in the journey of aging. You are the driver. So next time someone suggests a test, pause, ask questions, stand tall. And remember, the strongest choice you make might be the one to say no. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.